Well, welcome to Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of Whitewater Community Television. Very glad you're able to join us. Thank you for joining us an hour earlier than normal for this conversation with Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health, talking and answering your questions about COVID-19. We moved the show up because we, for our educational access station, WETV, will be doing a live Indiana University East basketball game beginning at 3, and the staff needed just a little bit of time to kind of make that transition between one live program and another. But COVID has even affected that. We found out just the other night the team that IU East was supposed to be playing today, one of the teams in the tournament was not able to make it, so they had to change who they were playing today because of COVID. There were 2 IU East basketball games that were supposed to happen next week that are not going to happen due to COVID. So it is really taking over a lot of things. Obviously, you gentlemen have been looking at the numbers and dealing with patients all week. I haven't asked you for a while, how is the staff at Reed Health?
That's a great question, and although we're managing with the current volumes, and when we get to the numbers, we can see how high those numbers have gotten. I would say that everybody's coping. We're all professionals. We know what we're doing. We have the experience of working with COVID-19 in the spring that helps tremendously. But there is a certain fatigue factor that is beginning to set in, and especially as we expand the numbers and expand the footprint of the COVID-19 containment areas in the hospital, it's exhausting for people. So we really need the numbers to come down so people can feel like they can take a breather.
What's new with you this week?
I think probably for me, aside from the increases in numbers locally and nationally and in the state, probably the 2 big things for me are that a vaccine may be on the horizon. We may, within the next couple of weeks, have a small supply of vaccine doses in the county that will be available for distribution to certain high priority targeted populations. That basically is going to be healthcare workers, particularly those who work with the disabled and elderly in long-term care facilities, is the very first priority target. And some people have asked the question, well, shouldn't it be the patients in those facilities? But actually, when you think about the route of transmission into those facilities, the residents of those facilities are very well, they're sort of walled off from the world in a lot of ways. The way they get sick is from people from the outside bringing it in. And the people who come into the buildings most frequently are staff. And there are any number of outbreaks in long-term care facilities around the state that have been traced back to, staff being positive and it behind the scenes causing other staff to be positive, and then it getting ultimately transmitted to residents. So I think the state is making a very wise decision to focus on the healthcare providers in that environment. But the other targeted populations will include other healthcare workers, particularly those who work in urgent care, COVID-19 testing sites. Our respiratory clinic would be an example of a place that the people who work there we want to target for vaccination, but we only have a limited supply of the vaccine, or will have, and so we don't know yet how deep into the pool of people that we'd like to get vaccinated early we'll be able to go. The other thing that is very interesting to me, has been really since the beginning, is the prospect of monoclonal antibody treatments, and it may sound like a little bit of inside baseball, but basically it is genetically engineered means of manufacturing neutralizing antibodies that are then given passively to people. So it's not dependent on people who are infected with the COVID-19 developing their own antibody response, which can be quite variable and takes a while to ramp up. If we can catch people before a certain point in the illness and give them neutralizing antibody, if they are at high risk for complications, then the early studies with the 2 main candidate monoclonal treatments that are on the market, one from Regeneron, which is the product that President Trump received when he had COVID-19, and then Eli Lilly has a version. One or both of those may receive federal emergency use authorization soon, and the Department of Health and Human Services is asking hospitals to begin to think about how we might deploy that if the EUA comes through soon. And what that has the possibility of doing is, based on the early results, which show much more rapid improvement, much less likelihood of needing hospitalization, lower death rates in those who receive the candidate drugs, both the Regeneron and the Lilly version, as long as it's before a certain point in the illness, then this could revolutionize the way we manage COVID-19 and make it a much less deadly disease, and really reduce the pressure on hospital resources when there are spikes and so forth. So I've always been interested in that. I'm glad to see that coming along soon. So I think between vaccine and monoclonal antibody, we have the potential to enter a new phase in the COVID-19 story to make it a much less serious problem.
We always want everything now.
Yes.
What are you seeing as a time frame for some of this really being able to hit the general public?
I think the monoclonal antibody actually may be more generally available more quickly than vaccine will be. But both of them may receive emergency use authorization within the next few weeks, as early as the next few weeks. I think the vaccine is going to be something that'll be a little bit more of a trickle-out effect over a number of months, but hopefully the monoclonal antibodies will be something that will be available much more quickly. And that's not something that you're just going to go to the drugstore to get. It requires an infusion in an infusion center, so it's kind of a big deal. It's not easy to do, but for the right person, we hope that it can really make a big difference, and it seems to have in some of the studies. In studies where they've given it later on in illness, like when people are already in the hospital and on the verge of getting into the pattern where we see the oxygenation requirements climbing rapidly. If you wait until then, it's less effective. And the reason why is because at that point, the illness is switching over from a purely infectious problem to one that's more of a runaway immune response, a dysregulated immune response, something that people have typically called the cytokine storm. And when it gets to that point, the antibodies are less effective because it's really not about neutralizing the virus at that point, which the body's already beginning to take care of. But then you have to switch tactics to try to modulate the immune response to bring that down.
Because it would be an infusion type of thing, there's really only so many people you're going to be able to bring into this regimen.
Yeah, that's true. So I don't think the average person on the street, a 30-year-old who gets COVID-19 and otherwise is not at risk, doesn't have any of the big risk factors, is probably not going to qualify. We don't know what the standards are going to be yet, but I'm assuming it's going to really be more for those who have one or more of the big risk factors. Things like age is far and away the biggest driver of risk for poor outcome, particularly over age 70. And the higher the age over that, the more likely the poor outcome. But also, men more than women have higher risk of poor outcome. That's always been the case. And when you look at the death statistics, men always outnumber women significantly. The third big one is being overweight. A body mass index over 30 is a big independent risk factor over and above other things. Mm-hmm. And then you get into a number of other situations. There are some ethnic breakdowns. Latino and Black folks seem to be at a higher risk. It's a little bit hard to know right now exactly why that is. We think it has more to do with those are populations where access to health care may be more limited, or there could be things about the way we've organized healthcare in society that we can do better for those folks to reduce their risk in the long run, not only from COVID-19, but from lots of other problems. But they also tend to be much more likely to have the BMI problems, have diabetes, which is another independent risk factor. And So I think what we'll see with the monoclonal antibody treatments, because it will be expensive, it will require a lot of rigmarole to get it done, it's probably, at least in initial stages, going to be pretty limited to those who meet certain a risk factor scoring above a certain amount that will depend on some of these risk factors.
Dr. Jetmore, the
Yes.
Health Department office has had another busy week. Tell us what you know, Nip.
Yeah, well, in the line of what Tom was saying, I read an interesting article today. We're looking ahead for treatment. Some basic research scientists at Columbia University have created a lipopeptide which can be used to keep you from getting COVID. The way this works, the COVID virus attaches to what are called ACE receptor sites in the respiratory lining of the nose and the lungs. And if you can keep this virus from attaching, a person can be exposed to coronavirus but not get coronavirus. It can't attach to your body. They tested this out. You'll be interested in this, Eric. The test subjects were 6 ferrets.
Seriously?
Yes. 3 of the ferrets, brings us back to our pangolin days, doesn't it?
Yes.
3 of the ferrets were given the lipopeptide, and the 3 weren't. The 3 that weren't given it got COVID. Now, everybody that's watched this show knows that none of us consider this a stage 3 trial. So
Right.
we're a long way from doing this for people. However, this is a white powder. It can be shipped. It can be shipped without refrigeration. It's reconstituted with water. It can be used as a nasal spray. So if this were to come to pass, it would be a neat treatment. And I would spray my pangolin's nose with this to keep it from getting infected.
I think that's
have
a
no doubt that you
fantastic
would.
idea. It's obviously needs a lot more study and is a long way from being accessible.
Who knows how far out
But
that is.
theoretically, I think it's perfect, and it's something that for a long time, I'm kicking myself because I've actually been thinking this for months, and I wish I had mentioned it so I could sort of take credit maybe for the idea and get it on the patent or something. But, I have a feeling that the root of infection is really probably more through the nose. We know that the ACE receptors are more populous in the nose than they are in, say, the oropharyngeal tract or the oral portion of the air digestive tract. And I've thought, if only there was something that could either knock down or kill the ACE receptors in the nasal tract or block them. And so you're talking about something exactly like that.
The scientists at Columbia have stolen your idea, Tom, and are well on the way
All
to
right, I'm
making
going
a fortune.
to get with my patent attorney and get on them.
Well, as far as Wayne County goes, we've had 2 more deaths today, which is saddening. A 71-year-old man and an 84-year-old man who were not long-term care residents. So that brings our total death count to 42. And 24 of those 42 were in October alone. The kids that are being out of school, that number's trending upward. In the last 2 weeks, there's been 258 kids that are out, and that doesn't count Hagerstown. I don't have those numbers. Most of this transmission, as we said last week, I think, has not been occurring within the school. It's the students are catching this infection elsewhere. Our positivity rate is trending upward. Going back to last Saturday, a week ago, we were having 19 a day, then 24, then 31, then 76. And then yesterday we had 44 positive cases. So we're running right at about 12%. We're testing on average over 200 patients a day. But based on we're assigned a color code for our county. We're still at orange, the highest number being red. Our weekly cases figured per 100,000 population is at 506, and our 7-day positivity rate is 11.4. If this goes to 15, we'll be bumped up into red. We're at 2.5. If we make it to 3, we'll be red, which is alarming. There are only 2 counties in the state that have reached that are at that level right now, one of which is Fayette County. Mm-hmm. And I mention Fayette County because there's a lot of traffic back and forth between Fayette County. I think Fayette County many residents of Fayette County work here. They travel here to shop and do business, and their positivity rate is 22%, which is the highest positivity rate for any county in the state.
I know that's got to have you all on edge with your relationships down in Fayette County.
Yeah, Fayette County folks are great people, and we enjoy working with the Fayette County Health Department folks, but it's a small county and pretty dispersed population, so it's a real challenge to kind of reach everybody with the right education about how to be vigilant and kind of stay on message with that. So we're trying to work with our partners there in that county to help them. But I think the silver lining to these high rates is that the state has been sending in some National Guard folks to help man testing stations and do education and do other things. And the feedback that I've heard from, there are a few in Wayne County as well, actually, and the feedback that we've gotten from Christine is that that's been really, really helpful and enabled her to focus on some other priorities, and Fayette County folks are getting that same benefit. So, we're hanging in there with them, trying to help however we can.
I can tell you've been doing this for a while. You know how to do that perfect lead-in. We do have Christine Stinson with us, Executive Director of the Wayne County Health Department. She is actually at the Elder Bierman testing site, and she is joined, hopefully I have this right, by Sergeant McKibben, who is a member of the Indiana National Guard. Christine, how are you?
I'm good. Can you guys hear us okay with our mask on?
We can, actually, yes.
Okay. Good. Well, we're here at the Elder Bierman building at the testing site. If you want to orient yourself, the testing site is that way. So this is all just vacant building, so it's kind of echoing in here. But I thought I would introduce you to one of our Guard members here. So this is Sergeant McKibben, and he'll talk a little bit.
Well, I'm here with the Indiana Army National Guard. We are here to assist the health department in registering people at the site. Really, I just want to encourage people to come in and get tested. We can do rapid testing along with the traditional testing, PCR. And we are limited to only 50 a day for Wayne County residents and first responders of the surrounding area. And it is free testing, and we can do ages 2 and up. So I just want to encourage people to come in.
Sergeant, thank you for what you're doing. Why don't you real quickly tell us a little bit about yourself? Where are you from? Where are you coming in here from?
I'm actually from Clinton, Indiana, opposite side of the state. But we have soldiers from all over the state. We go wherever we're needed on a moment's notice. So I'm originally from the Rockville Armory, but we go wherever we're needed. So.
When you were given this assignment, what were you all told as far as when you were deployed to these areas?
We were told we'd be working testing sites and working alongside the health department. It was a little bit of a struggle learning the system with the computers, but once we figured it out, it was very simple, and we're just here to help also in any other ways we can.
Dr. Huth?
Sergeant McKibben, it's Dr. Huth here. We met a short while ago when I came down and visited with you all at the test center, and I wanted to tell you thank you for being there. Appreciate everything you do, and thank you for your service. And I think you told me that you're an Iraq veteran. You deployed to Iraq back in 2007 or so, and
yes.
Thank you for that service. So what about all this is as you expected, or what about it is surprising as you've come into the community and started to execute this mission? what have been some learning points that you've picked up along the way so far?
I'm surprised at how long it's been going on. I'm not really surprised on the vaccine. I mean, it's a lot of research in that. I'm hoping that the vaccine comes out soon, so the National Guard will surely help with that in any way we can. And we have the ability to cover the entire state very quickly, so we'll respond, as needed for that.
Well, Sergeant McKibben, thanks for helping us. We've, the Health Department, this is Dr. Jetmore here. We've been, between testing and all of the contact tracing we've had to do, our department's just been overwhelmed with work. And so you really have been a lifesaver and come almost literally in the nick of time. So thanks for your service. Thanks for helping us.
You're welcome. We're here to help in any way we can.
I will tell you, since we've had the National Guard here, with Sergeant McKibben's help, we've started doing curbside testing for some of our most vulnerable residents in Wayne County. So Sergeant McKibben and his guys will go straight out to the cars and register patients, and then we'll send our testers out there to do a swab. So some days we run up to 30% positivity rates in our testing site here. So we really want to get people in and out very quickly when they come in here to be tested. And with the help of the National Guard, we're testing, like you said, over 200 people a day, some days upwards to 300 people a day. And people are moved through very, 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 very swiftly thanks to the Guard and how well they perform and how organized they are.
Christine, it's Dr. Huth here, and I'm going to throw maybe a little bit of a curveball at you. If you can't do this, that's fine. But, I've been down and walked through your process a number of times, and I think you've got a very good process there. Is it possible for you to kind of turn the camera around and essentially walk through the surface and kind of show people the process from beginning to end and how easy it is and the steps to it?
Yeah, we might be able to do that. I'm just going to carry this and so I don't think I can turn my camera around, but I got a patient in here right now. I don't want to violate anyone's privacy, but I'll get through here and then kind of turn you guys around here and show you the site. So this is where you enter into the COVID testing site, and then we have 5 stations for registration. I'll introduce you to some of our other soldiers that we have here. This is Specialist Helms. He's been here with us since the beginning. So since October the 19th, we've had McKibben and Helms here, and then Specialist Bell joined us. He's at lunch, so I had to let him go. But you would come in, and you'll see one of the. Hold on a minute. Where am I at here? Yeah, here we go. You'll see one of our registration stations. You'll register quickly. If a person registers online, this goes a lot faster. But after you get registered, you'll come around. I've got people getting swabbed right now, so I prefer not to turn around and show you that part of our testing site right now. But we have a lot of signage that helps you navigate through the testing site.
Yeah, so basically it's 2 quick stops, register, and if you're pre-registered, that part is super fast, and the pre-registration process online is really easy. And then the second stop is at the actual testing station with one of the young ladies who grabs the specimen, and that goes really fast. And so you can be in and out of there in under 5 minutes if there's not a line, and if there is a line, maybe twice that.
Yeah, we definitely try to get people through it as quickly as possible. And pre-registration really helps. So if you go to scheduling.coronavirus.in.gov, you can register for an appointment. The downfall of that is if all of our appointments are full for the day, you won't be able to register. So I have been talking with the state to change the platform to allow you to register to be in a waiting room where you can walk in, because we do walk-ins. Like I said, we have done as much as 300 in one day, and we could have serviced more than that in the day. So if you can't get scheduled for an appointment because all of the appointments are full, don't let that deter you from getting tested. You can come here and do a walk-in. And remember, the Cambridge City site is still open, the OptumServe site, so you can always go to Cambridge City. They also do walk-ins as well.
Is there a better time during the day? If you're going to walk in, I know you prefer people register, but if they're going to walk in, are there times during the day, Christine, where it seems like things are a little bit slower, first thing in the morning, near the time you're closing? What can you tell us about that?
We tend to get 3 rushes a day. One, early morning, we open at 8 a.m. Usually about 9 o'clock, we get a little bit of a rush. Then there's a slowdown around 10. And around noon, we have like a lunchtime rush. And then it slows down again. And then in the evening, around 4 or 5 p.m., we get another big rush. So if you can come before 4, would be the best time. But we're open until 6.
Yeah. So we're open from 8 a.m. to 6 p.m. The OptumServe site in Cambridge City is open from 8 a.m. to 8 p.m. Our site will be open on Black Friday, but we'll have smaller or limited hours. We'll be open from 10 a.m. to 4 p.m. on Black Friday. We're not open on the weekends. I could take you over and show you one of our swabbing stations. Now I don't have anyone there. You'll get to meet one of our swabbers. She's really excited about this because I haven't told her that we were going to do this. So this is then where you would come and you would be swabbed here at our swabbing station. And she's been actually, Melena used to work for the OptumServe testing site when they were here at the Elder Beerman building. And when we decided to take them to Cambridge City, she decided to stay here in the Elder Beerman building. So she's been doing COVID testing and working in a testing site since testing had started. So we were really happy that she stayed with us and helped us get our processes down and everything.
Christine, before we let you go, what else do you want people to know? What do you feel like you need to share today?
We need more compliance with the only tools that we have to combat this, and that's wearing the mask, practicing the physical social distancing. I keep saying if you're sick, stay home, but I feel like I probably should modify that and say if you have symptoms, stay home, because a lot of people have symptoms, they don't feel like they're sick. So if you have symptoms of COVID-19, you've been exposed to someone who is positive, follow those quarantine and isolation guidelines. We need to slow this down. If we go to red, there's going to be some painful decisions that'll have to be made, in particular with the schools. And we would like to see the schools stay open through this, but with cases exploding like they are, some of the things that are recommended from the state are to close your schools and go virtual learning for a while. And I don't want to see that. So if we can all come together as a community, wear the mask, let's get through this until we can get a vaccine and keep our schools open. Some of the things that are recommended from the state.
Okay. Christine Stinson, Executive Director of the Wayne County Health Department, and Sergeant McKibben from the Indiana National Guard. Thank you both very much for your time today. We greatly appreciate it.
Thank you.
Ryan, when you get a chance, I'm going to ask you to put the 2 slides back up that will tell us about the testing site. You had the one up previously. Just a reminder, community testing available Monday through Friday, 8 to 6, the old Elder Beerman site, 601 East Main Street. You see the information there on the bottom of the screen for being able to register. Don't let that deter you, as Christine mentioned, if registration is not available. They are still taking those walk-ins. And then the OptumServe site over in Cambridge City, which is available at 138 West Main Street in Cambridge City, open 8 a.m. to 8 p.m. All of those are Monday through Friday. If somebody feels like they need something on the weekend, what do you tell them?
Well, if they're sick, they need to contact their healthcare provider to kind of get evaluated for that, because maybe it's less about getting tested, but more about evaluating the symptoms and make sure you're not so sick that you need to have a higher level of care. I wish there was more testing availability on the weekends, but I think our resources are kind of stretched about as far as they can go at the moment.
Yeah, I think that's the case. There just is not enough personnel to drive that, even though I think there is a need for it. Maybe that'll come. It's been a big help having the National Guard relieve some of the work for our staff. Maybe we can get more guardsmen.
I guess we could also mention that there is testing available at the CVS, I think, on
Yeah.
Chester Boulevard is doing it. I don't know their hours or anything, but that might be an option.
I don't know, do they do that on the weekends, CVS?
I just don't know.
I wish I knew that. We'll try to bring you that information when we find that out.
Okay. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook, and also thanks to the folks down at TV3 in Connorsville for continuing to air this program and provide this information to the community. If you have a question or a comment for the doctors, you can put it on our Facebook page, or you can send us a tweet to @WCTVinfo. I want to get to some of the questions that we have gotten in so far. So if we have a chance, we can start to kind of line those in. Understanding that people of color are impacted significantly worse by COVID-19, what has been done to address this in Richmond?
Gosh, I don't know very much about the actual statistics in Wayne County and the surrounding counties about what the disparities are in terms of particularly the racial and ethnic aspects of it. So it's hard to comment on whether we have a problem just like the rest of the state does, but certainly it's an issue in the state. And I think really at this point, initially, what we need to be doing is encouraging the folks in high-risk groups to, A, take care of themselves and avoid exposure. B, the people who know them, who are in their bubble of friends and family, who may not be as high at risk, need to take care of themselves so that they don't become a conduit to them. But in the long run, what this is going to take, Eric, is really looking at how we've got our healthcare resources organized to reach out better to the Latino community, to the Black community. And I would mention that there's also some evidence that the Amish and then certain other sort of minority-type groups also may be disadvantaged when it comes to disproportionate outcomes with COVID-19. So I think these probably relate more as much to social things that we can fix as a system. I just can't fix them as a system right now. The main thing we can do is make sure we make all these resources that we're developing available to everybody and encourage the folks from those minority-type communities to access those, and don't be afraid to come and take advantage of them, and just come in and get tested. And if there's any question about any kind of symptoms, contact a healthcare provider. We've still got our free COVID-19 evaluation line that's available, and maybe next week I should bring back the web link for that and phone number. We want to encourage everybody to be aware of those and utilize those as much as possible, regardless of who they are. And as a community, we've got to come together and make sure that everybody who can possibly be disadvantaged in this has special attention and care paid to them.
Yeah, I think in the long term, we as a society need to address some of the disparities and inequalities of the socioeconomic conditions of minorities, the associated comorbidities with health, which that can also be addressed. In the short term, I think the very best thing we can do is to give them the very best care we can if they are unfortunate enough to get COVID.
The one thing that I've continued to hear is even more of a realization that there are disparities in how the healthcare system treats different people. I've heard that from a lot more people over the last few months, particularly in the medical profession. And it's not like they weren't saying it before. It just seems to be a louder conversation now.
Yeah. I mean, you know, we've just organized the care in ways that may not be, need to be more, perhaps need to be more tuned for specific scenarios. You know, if we were in downtown Indianapolis, are there enough doctor's offices and access points for care in the more disadvantaged neighborhoods? Well, we have disadvantaged neighborhoods. Do we really, in this community, do we really make care as accessible as it could be? And I think those are the kinds of questions we need to ask ourselves going forward. I know that, you know, through the READ system, we've been, you know, trying to pay attention to those things and make some of our services more accessible to different neighborhoods. But there are all kinds of challenges and hurdles to overcome to doing that. On the flip side of it is we can set up access points, but people have got to access them. You know, so I think there may also be a communication, a dialogue has to happen with maybe the leaders in those communities particularly, but within those, between the healthcare system and inside those communities to figure out, okay, how can we make this better for you? What would make you feel more comfortable accessing our care that we want to provide you, and you know, so that people who have especially if they're at higher risk for conditions like diabetes and being overweight and smoking cessation and all those things, what do we need, and how can we get those resources more utilized? And you know, we can take ownership for what we can place services and get the right services in the right place at the right time. But I think there also has to be more interaction with those communities to develop the relationships so that people will feel more comfortable accessing the care and improving their health.
Dr. Thomas Huth, Reed Health, Dr. David Jetmore, Wayne County Health Department. They're the doctors taking your questions on our Facebook page, also at WCTV Info. Next question up. With the increase in COVID-19 positives and the increased load for tracing, is there a need for volunteers in the community to make tracing calls to help the health department?
I think that we could use help from volunteers, and I think if anybody, it's not a difficult skill to learn to do contact tracing. Most of this work is done on the phone. But I think if there are people that would be interested in volunteering, I think that they could call the health department and leave a message for Christine Stinson, the executive director. And because I don't know what the needs are going to be in the future, it just seems like every day, Eric, we need more. We need, you can see we've got the National Guard here helping us do testing. But I think contact tracing would be a great entry point for somebody to help us.
Okay. Next question up. Can we get some clarification on who is responsible for reporting to the state information from schools? The state has a dashboard with the school info, but nothing from Wayne County. I know that has been a part of the conversation here 2 or 3 different weeks as to how that works.
Well, the responsibility for reporting this information to the state is the school's responsibility. When this initially came about, I thought the mechanism would be that the schools would report to the health department and then we would report to the ISDH, which keeps this dashboard. But that is not the case. So I don't know why these schools haven't reported, but that's it's their responsibility to get this information to the state.
So I guess there are some questions in there that we can't really answer right here. One is, you know, I can imagine that the schools have some of the same challenges that we have. You know, how do we organize, how do you organize your resources to do all the testing, do all the contact tracing, and there's just limited resources to do that. The schools may have the same challenges. They've got, the Richmond Community Schools, as one example, has a number of schools all around. How do you organize a system to efficiently gather that data and get it reported up into the system? It may be a work in progress. And the other thing that I don't know that we can't answer is the dashboard is there, and the state wants to report that information, but what is the actual requirement that they have on the schools, and do they have, maybe there's a timeline by which they've got to be doing it consistently that we're not aware of. And then, so I think there's just a couple of examples of the challenges that we don't really know, and, we've answered the question about as much as we can, and maybe the next step would be to
we don't know why the school hasn't reported. I
have
didn't address that part of the
conversations
question,
with-
only that if the school's going to report it, it's up to them. And this may be a low priority item for them. I mean, they're, many of these schools are up to their neck in alligators with the problems that they have with
Yes.
cases and going to virtual learning, going back again.
I guess what I'm trying to say is I don't know. The fact that there's not data for Wayne County schools yet, I do not know whether that means they're living up to their obligations. We don't know exactly what their obligations are so far. So that might be worth having a conversation in the future with one of the educational leaders to talk about how they're doing it, or what the challenges are.
We've talked to a couple of the superintendents. I'm sure we can reach out and probably get one of them to come back and provide some answers. You're watching Ask the Doctors on WGTV Channel 11. We are taking your questions for Dr. Huth and Dr. Jetmore. Next one. Has there been any more information found about the transmission to or from pets since the beginning of the pandemic? Well, we know they're messing around with ferrets, but
well, I mean, I think that the list of animals that you can at least experimentally transfer, cause to transmit virus has grown. I think it includes ferrets.
Mink, I think. There's been a case of a polar bear in the zoo. Right. There's been a couple cases of dogs. But specifically when you're talking about pets, which to me means for the vast majority of people, dogs and cats, those cases have been very, very small.
Yeah.
And so I would not worry about that being a problem if I was a dog or pet or a cat owner.
Right. So, I mean, when you think about pets particularly, dogs and cats, they're kind of a part of my bubble, right? So really for my dog or cat to get COVID-19, I kind of have to bring it to them, don't I? Ordinarily.
Yes.
And so
I assume you wear a mask when you're around your dog or cat.
I should probably, if I had a dog or cat, which we don't anymore. But so I guess the question is, even if the dog or cat can't acquire the virus, what implication does that have? I mean, they can't really infect me back, so it's kind of a dead end. I mean, think as far as the transmission chain goes. So it's an interesting concept, but I would not regard household pets, standard household pets, as being a transmission route into a family. That would seem to me to be very unusual. And as you mentioned, Dr. Jetmore, the cases where they have seen pets have COVID-19 are kind of newsworthy because they're exceptional and unusual. If it were a very common thing, it probably would be no big deal.
Yeah.
We're going to take one more question, and then we'll turn to Dr. Huth for his weekly look at the numbers. So next question up. We know COVID-19 is in our community, and at Reed, what about seasonal influenza? Is Reed seeing patients needing hospitalization for influenza yet?
We have had a few cases detected. They're not large numbers. I'm not sure about the rest of the county, or if even in the health department really gets that information. It's not reportable in the same way that COVID-19 is. And we had one case of somebody infected both with COVID-19 and influenza who spent a short period of time in the hospital but got well. Other than that, I don't think we've seen much flu in the community yet, and that of course is big on our worry list, that it could also become an issue in the community. So we don't want to see a co-wave, a wave that consists of COVID-19 and influenza. That will really be very bad for stress on the health resources and implications for, schools and our economic life and social life and everything like that. So we really, really need to avoid that. But so far, flu has not been an issue. And this would probably be a little early compared to most years for significant influenza, high levels of influenza, which have tended to peak in December, January, or even later. So it's a little bit early. I don't want to minimize the possibility of influenza. We're very focused on COVID-19 right now, but influenza will probably be a topic in the future to come back around.
And and wearing masks may dampen down the
Yeah.
influenza season this year.
Hopefully, yeah. That's one theory about why influenza in some big southern hemisphere countries in our summer, their winter was not so big, and so that maybe bodes well for us.
The voice in my head tells me there's a quick follow-up to that. So will the health department be doing drive-through flu shots? If so, when?
Well, I wish I knew the answer to that. I think the first part of that is probably. We probably will do drive-through flu shots, but I don't have a timetable for that. And one of the main reasons is because we've been so, COVID-19 has devoured all the oxygen in the room. But I will take that question under advisement and have a more thorough answer next week. How's that?
That works. Listen, that's one of the reasons we do this every week, so that things that we don't know, we can find out, and things have continued to change on a week-to-week basis. We look at the numbers that you provide, Dr. Huth, and we go back 4 or 5 weeks, and the numbers are nowhere near the way they're looking right now. So obviously, it's a changing thing.
Right.
We've got about 10 minutes left in the show, so let's start to take a look at what you've provided for this week.
Okay. As soon as Ryan's ready to show those. These are the Wayne County weekly lab positive cases. I compile this, and actually Christine has a very thorough set of indicators that she compiles almost basically on a daily basis, but I take and provide this one from the data. And we can see that for the week ended last Saturday, October 31st, Wayne County had 354 positive cases. And there really aren't very many clinical COVID cases these days. I mean, I think in the last few weeks there's been maybe a small handful, 2 or 3. And I don't include those. I just put the lab positives on here because they're more certain. But the gray bar at the end is this week so far through yesterday, which really the week starts Sunday. So Sunday, Monday, Tuesday, Wednesday. Thursday is 5 days. If you project that out, the week should end hopefully a little bit lower than last week's, in a neighborhood of about 250 lab positive cases. And when I was down at the testing site earlier today, Christine and Sergeant McKibben said they thought today's volume seemed a little bit lower than they had been seeing. So maybe the lower number this week will pan out, but it's still high historically, which is obvious to everybody. If you move over to the next one, Ryan, these are the age breakdowns of the positive cases, and for each grouping, the dark bar on the right side is the current period, now October, November, that I'm aggregating together there, and we can see that in the highest risk age group, 70 and up, 70 to 79 and 80 plus, have a total of about 20% of the cases of the lab positives are in those age groups, which is much higher than they had been. And the reason why I paid a lot of attention to that is because the risk for fatality is so much higher. And on the next page, this is my I have the sad, unfortunate duty of bringing to everybody's attention the fact that all these significant numbers of cases, now about 238 since October 1st in 70 and up age group, implies a certain risk of mortality. And we've seen a version of this graph before, but the first bar is all of the deaths up to October 1st was 15. The whole pandemic to October 1st, 15 from Wayne County. And just on the cases, the positive cases, those 238 cases over age 70, we should expect about 36 deaths so far. And the actuals are up to 27. So it's 24 for October and 3 so far in November. You know, I hope I'm wrong. I hope that, you know, things are actually improving in various ways and that the deaths won't get up to that 36 level. But, you know, I'm not confident that'll be the case. We know of a couple more congregate or congregate facility outbreaks that are underway currently and in vulnerable age groups. So, you know, we're not by a long shot out of this. And but I think it's worth everybody knowing that, you know, this is okay. There's this virus going around, and most people don't get very sick with it. But the reality is, when it gets into the wrong age groups, it's a very dangerous thing. The last bars or last set of graphs there is the read volumes, and these are the actual dailies. Sometimes I bring average for weeks and throw over the whole pandemic, but this is just the actual dailies for the last 4 weeks. In the last set of bars on the right, we can see that today, this morning, we had 68 people in containment areas. That is way significantly far and above at any point prior in the pandemic. The previous high was about 62. And then the red bar of 37 there is the known positives in the hospital. That is also just squeaking into an all-time high for us. And then the most concerning is the lowest bar there, the gray bar that is COVID patients on ventilators. We're at 5 and have been for the last couple days. And that is a number that we haven't had since early May. So we're running at about 90 to 95% of our capacity for general surgical beds, about 80% capacity being utilized for ICU resources, which that's more manageable. But because the general medical surgical utilization is staying high, we've actually opened up a couple of, whether joints, so it really is one big area, we've a temporary extension of hospital beds into our infusion center and chemotherapy center, move those services to their own temporary location, essentially created 21 more beds that will help with our capacity issues, but will overwhelm that if the trends continue up. And I think this morning we had about 8 open beds, something like that. And you know, and just to understand what that means, as a practical matter, we typically have at least 30 admissions a day. Some of them are planned admissions for surgeries and such like, but then an awful lot, a big proportion come through the emergency department. And when we've got a lot of COVID-19 admissions, we can get up to 40, 50, 60 admissions a day. So when I've only got a margin of 8 beds, I've got to run around and find ways to move other people along faster and create more beds. You can understand that's a constantly sort of churning process. But when we're constantly having to undergo that stress of creating more space for the next person to come in and minimize the waiting in the emergency room and so forth, that's a lot of work on a lot of people's part to make that possible. And that's what adds to the fatigue and exhaustion factor on the staff. And so we need all that to stop and things to settle down so that people can have a breather. And but also for the patients, you know, these look like numbers and bars on a chart, and you know, you can kind of feel a little bit distant and abstract from it, but these are real people suffering. And we don't want it, you know. So we've got to turn that around.
Dr. Jetmore, we've got 3 minutes left in the show. I'm going to kind of give you a chance to say whatever you feel like you need to say as we begin to head out of here.
Well, I think everybody that ever watches this show knows what I'm about to say. We're in the middle of the biggest pandemic in the past 100 years, and we're in the thick of it. As the guy in Perfect Storm said, she's coming on, boys, and she's coming on strong. All of our numbers are going up, and this is a very real public danger. It's a force of nature, like a hurricane. And we all need to take care of ourselves, but most importantly, take care of each other, Eric. We need to wear masks to protect our fellow citizens and loved ones from the possibility that we could be an asymptomatic carrier of the virus and spreading it around. We need to social distance. If we do this, the rewards are we'll be able to keep our schools open. We'll be able to keep our local businesses open. We'll be able to continue our lives with that modification. So I would encourage my fellow citizens to mask and socially distance and avoid large gatherings.
Okay. Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health, also a guest on the 5 p.m. WHIO TV news. You can find him on LinkedIn, you can find him on Twitter, you can find him on Facebook. He's providing a lot of information out there, and we thank you both for the time that you continue to give each week to be able to do that. Mentioned we started this show an hour earlier than we normally do. We'll be back to our normal time next week at 2 o'clock. We started this one early because we try to live our lives. There's a live basketball game, the First Bank Richmond Classic, taking place in the IUE Student Events and Activities Center. That's what you're looking at right now. If you want to see some women's basketball action, we'll have it live beginning at 3 o'clock on WETV Channel 20 as the IU East Red Wolves take on Shawnee State. Okay, the Shawnee State Bears, I'm being told, and tomorrow they take on Goshen. So thank you very much for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. This is available in replay down in Connersville on TV3. We also have it on our Facebook page and also available on WGTV Online, our video on demand site. So we'll be back next week at 2 p.m., our regular time. Please put your mask on. As always, I wish you well. Have a great weekend.